Would you like free audiobooks? Click the link in the description. Question 1. A nurse is caring for a patient who has undergone lymph node biopsy. Which of the following findings should the nurse prioritize for immediate action? A. Mild pain at the biopsy site. B. Slight redness and swelling at the incision site. C. Drainage of clear fluid from the incision site. D. Fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. Correct answer. D. Fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. Rationale. A fever post-procedure can indicate an infection, which requires immediate attention to prevent sepsis or further complications. While mild pain, slight redness, and swelling are expected post-procedure findings, clear fluid drainage may be normal lymphatic drainage or could signify a lymphatic leak, depending on the procedure context. However, fever is a systemic response indicating potential infection. Question 2. When teaching about the lymphatic system, which of the following points should the nurse emphasize about its role in the body? A. It primarily transports oxygenated blood to the heart. B. It helps in the absorption of lipids from the digestive tract. C. It produces hormones that regulate blood pressure. D. It serves as the primary reservoir for blood plasma. Correct answer. B. It helps in the absorption of lipids from the digestive tract. Rationale. The lymphatic system is crucial for the absorption of lipids and fat-soluble vitamins, A, D, E, and K, from the digestive tract via lacteals in the intestinal villi. While the circulatory system transports blood, the lymphatic system does not transport oxygenated blood nor does it produce hormones for blood pressure regulation. It is not a primary reservoir for blood plasma but does contribute to fluid homeostasis. Question 3. A patient with lymphedema presents with swelling of the lower extremities. The nurse understands that this condition is most likely due to A. Decreased cardiac output. B. Inadequate venous return. C. Obstruction of lymphatic flow. D. Reduced arterial circulation. Correct answer. C. Obstruction of lymphatic flow. Rationale. Lymphedema is specifically caused by the obstruction of lymphatic flow, leading to accumulation of lymph fluid in the tissues. This is not directly related to cardiac output, venous return, or arterial circulation, which affect blood flow rather than lymph flow. Question 4. Which of the following actions is most appropriate for a nurse to take when caring for a patient with lymphedema? A. Apply tight compression bandages to the affected limbs. B. Encourage immobility to reduce lymphatic drainage. C. Perform gentle skin care and apply graduated compression garments. D. Recommend hot water immersion therapy to promote circulation. Correct answer. C. Perform gentle skin care and apply graduated compression garments. Rationale. Gentle skin care prevents infection, and graduated compression garments facilitate lymph fluid drainage and reduce swelling. Tight bandages can further restrict lymph flow, and immobility can exacerbate lymphedema. Hot water immersion is not recommended as it can increase swelling. Question 5. During a health fair, a nurse educates the community about risk factors for lymphatic diseases. Which of the following should the nurse include as a risk factor for developing lymphedema? A. High-protein diet. B. Sedentary lifestyle. C. Surgical removal of lymph nodes. D. Excessive intake of fluids. Correct answer. C. Surgical removal of lymph nodes. Rationale. Surgical removal of lymph nodes, especially in cancer treatments, can disrupt normal lymphatic flow and lead to lymphedema. Diet, lifestyle, and fluid intake do not directly cause lymphedema but may impact overall health and disease risk in various ways. Question 6. A nurse is planning care for a patient with a diagnosis of lymphangitis. Which of the following interventions should be included in the plan of care? A. Restricting fluid intake to decrease lymph production. B. Administering prescribed antibiotics. C. Applying cold compresses to the affected area. D. Encouraging frequent lower extremity elevation above heart level. Correct answer. B. Administering prescribed antibiotics. Rationale. Lymphangitis, an infection of the lymphatic channels, requires antibiotic therapy to treat the underlying infection. Fluid restriction is not beneficial and could be harmful. Cold compresses are not indicated for lymphangitis, and while elevation may help with lymphedema, it is not the primary treatment for lymphangitis. Question 7. A nursing student is learning about the lymphatic system's role in immunity. Which of the following statements by the student indicates an understanding of this role? A. The lymphatic system produces red blood cells that fight infection. B. It transports nutrients to the bloodstream to support immune function. C. Lymph nodes filter lymphatic fluid to remove pathogens. D. The spleen stores white blood cells and releases them during hypoxia. Correct answer. C. Lymph nodes filter lymphatic fluid to remove pathogens. Rationale. Lymph nodes act as filters for the lymphatic fluid, removing pathogens and foreign particles, which is crucial for the body's immune defense. The lymphatic system does not produce red blood cells or transport nutrients directly to the bloodstream for immune function. While the spleen does store white blood cells, it does not release them specifically during hypoxia but is involved in immune responses. Question 8. A patient with a history of breast cancer surgery and lymph node removal is at risk for lymphedema. Which of the following instructions should the nurse provide to minimize this risk? A. Avoid using the affected arm for blood pressure measurements and blood draws. B. Perform high-intensity exercises using the affected limb to promote lymph flow. C. Apply heat packs to the affected arm daily. D. Restrict fluid intake to reduce the amount of lymph produced. Correct answer. A. Avoid using the affected arm for blood pressure measurements and blood draws. Rationale. After lymph node removal, the affected limb is at increased risk for lymphedema. Avoiding blood pressure measurements, blood draws, and other procedures on the affected side can minimize this risk. High-intensity exercises may actually increase the risk and should be approached with caution. Heat packs and fluid restriction are not recommended strategies for lymphedema prevention. Question 9. In assessing a patient with suspected lymphoma, which of the following symptoms would the nurse expect to find? A. Hypertension. B. Enlarged, painless lymph nodes. C. Increased urine output. D. Hyperglycemia. Correct answer. B. Enlarged, painless lymph nodes. Rationale. Lymphoma typically presents with enlarged, painless lymph nodes, often noted in the neck, armpits, or groin. Hypertension, increased urine output, and hyperglycemia are not typical symptoms of lymphoma and may indicate other health issues. Question 10. A patient presents with symptoms of fever, night sweats, and weight loss along with enlarged lymph nodes. The nurse recognizes these as potential signs of A. Hyperthyroidism. B. Lymphoma. C. Diabetes mellitus. D. Congestive heart failure. Correct answer. B. Lymphoma. Rationale. Fever, night sweats, and weight loss, along with enlarged lymph nodes, are classic symptoms of lymphoma, known as B symptoms. These symptoms are not characteristic of hyperthyroidism, diabetes mellitus, or congestive heart failure, which have distinct clinical presentations. Question 11. A nurse is educating a patient on how to reduce the risk of lymphedema following breast cancer surgery. Which of the following should be included in the education? A. Limit the use of the affected arm to reduce lymph fluid accumulation. B. Perform prescribed lymphatic drainage exercises regularly. C. Wear restrictive clothing on the affected arm to compress the lymph vessels. D. Elevate the affected arm only when you experience swelling. Correct answer. B. Perform prescribed lymphatic drainage exercises regularly. Rationale. Regularly performing prescribed lymphatic drainage exercises can help prevent lymphedema by promoting lymph fluid circulation. Limiting the use of the arm, wearing restrictive clothing, and elevating the arm only during swelling are not recommended practices for lymphedema prevention or management. Question 12. A nursing student is asked to describe the role of the spleen in the lymphatic system. Which of the following statements is correct? A. The spleen filters blood, removing old red blood cells and pathogens. B. It is the primary site for lymphocyte production. C. The spleen stores excess lymph fluid to prevent edema. D. It regulates the production of antibodies in the lymph nodes. Correct answer. A. The spleen filters blood, removing old red blood cells and pathogens. Rationale. The spleen plays a critical role in filtering blood, removing old and damaged red blood cells and pathogens, which helps in fighting infection. It is not the primary site for lymphocyte production. This occurs in the bone marrow and lymph nodes, does not store lymph fluid, nor directly regulates antibody production in the lymph nodes. Question 13. When educating a group of nursing students about the lymphatic system, which of the following points should a nurse emphasize regarding lymph fluid? A. It is composed primarily of red blood cells and plasma. B. It contains nutrients and oxygen for cell use. C. It transports waste products and excess fluids back to the bloodstream. D. It is the main transporter of hormones throughout the body. Correct answer. C. It transports waste products and excess fluids back to the bloodstream. Rationale. Lymph fluid plays a crucial role in returning waste products and excess interstitial fluid to the bloodstream, helping to maintain fluid balance in the body. It does not primarily contain red blood cells, these are components of blood, not lymph, is not the main transporter of nutrients and oxygen, this is the role of the blood, nor is it the main transporter of hormones. Question 14. A nurse is caring for a patient with a compromised lymphatic system. Which of the following dietary recommendations is most appropriate to support lymphatic function? A. High sodium diet to promote fluid retention. B. High carbohydrate diet for increased energy. C. Low fat diet to reduce lymphatic workload. D. Adequate protein intake to support tissue repair. Correct answer. D. Adequate protein intake to support tissue repair. Rationale. Adequate protein intake is essential for tissue repair and maintenance, including the tissues of the lymphatic system. High sodium diets can exacerbate fluid retention problems, especially in patients with lymphedema. High carbohydrate diets are not specifically beneficial for lymphatic function, and while a low-fat diet can be helpful, it is important to ensure adequate intake of healthy fats for overall health. Question 15. In planning care for a patient with lymphangitis, which of the following goals is most appropriate? A. To increase lymphatic drainage mechanically. B. To reduce the metabolic demands of the lymphatic tissues. C. To prevent the spread of infection. D. To enhance the oxygen carrying capacity of the lymph. Correct answer. C. To prevent the spread of infection. Rationale. In the case of lymphangitis, an infection of the lymphatic channels, the primary goal is to prevent the spread of infection, which could lead to sepsis or other complications. Mechanical lymphatic drainage, reducing metabolic demands, and enhancing oxygen carrying capacity are not directly related to the primary concern of infection control in lymphangitis. Question 16. A nurse is assessing a patient for signs of a lymphatic disorder. Which of the following findings would indicate a potential concern? A. Pulse rate of 78 beats per minute. B. Blood pressure of 120/80 mmHg. C. Presence of pitting edema in the lower extremities. D. Respiratory rate of 16 breaths per minute. Correct answer. C. Presence of pitting edema in the lower extremities. Rationale. Pitting edema in the lower extremities can indicate a lymphatic disorder such as lymphedema, where there is an accumulation of lymphatic fluid in the tissues. The other vital signs provided are within normal ranges and do not directly indicate a lymphatic disorder. Question 17. A patient with a history of lymphedema is experiencing an acute episode of swelling. Which of the following interventions should the nurse prioritize? A. Prescribe antibiotics as a preventive measure against infection. B. Initiate diuretic therapy to reduce fluid accumulation. C. Encourage the patient to rest the affected limb in a dependent position. D. Apply a compression garment to the affected limb. Correct answer. D. Apply a compression garment to the affected limb. Rationale. Applying a compression garment can help reduce swelling by promoting lymph fluid return. Antibiotics are not routinely prescribed unless there is evidence of infection. Diuretic therapy is not typically used for lymphedema as it targets the vascular rather than the lymphatic system. Resting the limb in a dependent position may actually worsen swelling due to gravity. Question 18. A nurse is providing education on the prevention of lymphedema to a patient who will undergo lymph node dissection. Which of the following is a key point to include? A. You should avoid physical activity to prevent strain on your lymphatic system. B. It's important to maintain a healthy weight and engage in regular, gentle exercise. C. You can apply heat to the area daily to promote lymphatic flow. D. Limit fluid intake to reduce the volume of lymphatic fluid produced. Correct answer. B. It's important to maintain a healthy weight and engage in regular, gentle exercise. Rationale. Maintaining a healthy weight and engaging in regular, gentle exercise can help prevent lymphedema by promoting lymphatic flow and reducing the risk of blockages. Avoiding physical activity entirely can lead to decreased lymph flow and increased risk. Applying heat and limiting fluid intake are not recommended practices for lymphedema prevention. Question 19. A nursing student is asked to explain how the lymphatic system supports the immune system. Which of the following explanations is correct? A. The lymphatic system provides a transport system for white blood cells to move freely throughout the body. B. It produces red blood cells that are essential for carrying oxygen to immune cells. C. Lymphatic vessels secrete hormones that directly enhance immune responses. D. The system removes excess nutrients from the blood, which could suppress immune function. Correct answer. A. The lymphatic system provides a transport system for white blood cells to move freely throughout the body. Rationale. The lymphatic system supports the immune system by providing a network for lymph, which contains white blood cells, lymphocytes, to circulate throughout the body. This facilitates the detection and response to pathogens. It does not produce red blood cells, secrete hormones to enhance immune responses directly, nor does it remove excess nutrients from the blood as a means of supporting immune function. Question 20. In discussing the importance of the lymphatic system in fluid balance, which of the following statements should a nurse make? A. The lymphatic system removes excess fluid from the bloodstream to prevent dehydration. B. It recirculates fluid from the body's tissues back into the bloodstream to maintain fluid balance. C. The lymphatic system stores excess plasma proteins to prevent fluid overload in tissues. D. It increases fluid absorption in the digestive tract to ensure adequate hydration. Correct answer. B. It recirculates fluid from the body's tissues back into the bloodstream to maintain fluid balance. Rationale. The lymphatic system helps maintain fluid balance by recirculating interstitial fluid, including plasma proteins and other substances, from the tissues back into the bloodstream. It does not remove fluid to prevent dehydration, store plasma proteins, or increase fluid absorption in the digestive tract for hydration purposes. Question 21. A nurse is caring for a patient who is scheduled for a lymphangiogram. Which of the following should the nurse include in the pre-procedural teaching? A. You will need to fast for 12 hours prior to the procedure. B. The procedure will help us assess the flow of oxygenated blood through your arteries. C. You may experience a metallic taste in your mouth during the dye injection. D. This test will measure the electrical activity of your heart. Correct answer. C. You may experience a metallic taste in your mouth during the dye injection. Rationale. A lymphangiogram involves the injection of a dye into the lymphatic vessels to visualize them on X-ray. Patients may experience a metallic taste during the dye injection. Fasting is not typically required for a lymphangiogram. It does not assess blood flow through arteries, nor does it measure heart electrical activity. Question 22. When educating a patient about the lymphatic system, a nurse explains that lymph nodes A. Act as a primary source of red blood cell production in adults. B. Are responsible for the filtration of lymph and trapping of pathogens. C. Directly absorb glucose from the bloodstream for energy. D. Increase the production of lymph during physical activity. Correct answer. B. Are responsible for the filtration of lymph and trapping of pathogens. Rationale. Lymph nodes play a crucial role in the lymphatic system by filtering lymph and trapping bacteria, viruses, and other foreign substances, which are then destroyed by lymphocytes. They do not produce red blood cells, absorb glucose directly, or increase lymph production during physical activity. Question 23. A nurse is assessing a patient for potential lymphatic dysfunction. Which of the following symptoms would suggest a compromised lymphatic system? A. Sudden onset of chest pain. B. Rapid weight gain without changes in diet or activity. C. Frequent urination. D. Swelling in the limbs or face. Correct answer. D. Swelling in the limbs or face. Rationale. Swelling or edema, especially in the limbs or face, can indicate lymphatic dysfunction, such as lymphedema, where there is an accumulation of lymph fluid. Sudden chest pain, rapid weight gain without lifestyle changes, and frequent urination are not specific indicators of lymphatic dysfunction. Question 24. In teaching a patient about self-care practices to manage lymphedema, which of the following should the nurse include? A. Use high-intensity resistance training to strengthen the affected limb. B. Avoid air travel as changes in cabin pressure can worsen swelling. C. Apply ice packs to the swollen area to reduce fluid accumulation. D. Keep the affected limb in a lowered position to promote fluid return. Correct answer. B. Avoid air travel as changes in cabin pressure can worsen swelling. Rationale. Patients with lymphedema are advised to be cautious with air travel, as changes in cabin pressure can exacerbate swelling. High-intensity resistance training without proper guidance can increase the risk of injury or worsen lymphedema. Ice packs and keeping the limb in a lowered position are not recommended as they can restrict blood flow and worsen swelling, respectively. Question 25. A nurse is developing a care plan for a patient with lymphadenopathy. Which of the following interventions should be prioritized? A. Initiating aggressive fluid resuscitation. B. Monitoring for signs of infection around swollen lymph nodes. C. Applying continuous heat to the affected areas. D. Restricting physical activity to reduce lymph node swelling. Correct answer. B. Monitoring for signs of infection around swollen lymph nodes. Rationale. For a patient with lymphadenopathy, swelling of the lymph nodes, monitoring for signs of infection is crucial as lymphadenopathy can be a sign of an underlying infection. Aggressive fluid resuscitation, continuous heat application, and restricting physical activity are not specific or primary interventions for managing lymphadenopathy. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.